So another idea I had going forward with this device is one of the more difficult things is figuring out end-of-life care. Where, hospitals are closed, we don't allow family visits, and kind of the way I envision this is if we can have units where everyone that's not intubated is in these devices. Conceivably, family visits, obviously if they're COVID negative, I think is doable. Yeah. Whether they can schedule them and put them in certain rooms or make certain times of day where they're actually doing this, I think that's something that's doable, because this has been one of the hardest parts of our job is diagnosing these people terminally with it, and then that's it for them. So,
I mean, we're emergency physicians. We encounter a lot of bad things all the time, a lot of sad situations. In my opinion, the worst thing that I encounter is when somebody is suffering at end-of-life care and they're going at it alone. They can't have loved ones around them, where at the same time, your loved one is in the hospital suffering, end-of-life care, you can't say goodbye, you can't be there to comfort them. That is, for me personally, been the absolute worst thing in this entire pandemic. And having to somehow sit in between that and say on the phone, "I'm sorry, Miss Smith, your husband has passed. No, you can't come see him. I'm sorry." That's gut-wrenching. And to be able to set things up in just a simple way where everybody's safe and they can still come and have those at least close human-to-human interactions is a huge thing. It's massive. So it's a win-win situation in my opinion.
Yeah, so I think one of the things that really has been left out of these conversations is that kind of mind-body connection. So you have these elderly patients, often not even elderly patients, right? They could be in their 30s and sitting in the ICU on high flow or CPAP, BiPAP, intubated. And that mind-body connection, right? They're sitting there depressed. They don't have any connection to the outside world with their family members. And to me, I think that devalues their life and potentially negatively impacts their health and wellness.
Big time. I mean, the fact that visiting hours exist at a hospital is because nobody wants to suffer by themselves, and especially when they're terrified or facing the end of life, and not having anybody around you is terrifying. And having to sit in between this family that's on the verge of grieving and not knowing what's going on with their loved one, and then the patient themselves, who you're standing at the door because you're trying to minimize the amount of time that you are near them and around them and how many times you have to change your PPE, so they're locked in this room far away from everybody. You're at the door, their family is miles away at home, and trying to juggle that is horrible, and it's part of the darkness that follows you home. But being able to stand next to the patient multiple times, tell them what's going on, possibly, set up a way for their family to come in and see them in a safe environment for the family, for everybody else, is a big deal. That there's people that are like, I will go get COVID to see my dad die. If I can do that. We don't want to do that, obviously, because that's, against everything we know in medicine and spreading pandemic. But it's the reality of it. And so if we can facilitate that in any way, I think it's an amazing thing.
Right. Because if you think about it from a patient perspective as well, right, they're already sick, they're potentially at the end of their life, and their only human contact is someone wearing 1 or 2 gowns, a face mask, a face shield, a hairnet, literally, you can't see any of the skin.
You have no idea who you're even talking to.
I mean, it's great that some people were putting the pictures of themselves, and there's that one funny doctor that had a picture of Brad Pitt. I thought that was great. But that's still there's no connection to humans, right?
And that's a real big part of our job that people kind of don't realize that is really taken for granted, is we touch people every day. I put my hands on a lot of people every day. It's my job to touch people, which might kind of sound weird, but that human connection and the fact that I care about you, I'm trying to find out what's wrong with you, is a big way of how we actually practice medicine. And with this whole pandemic, half the time I should just be in a chair at home doing the medicine, and it kneecaps us severely in the way that we really properly practice medicine.